Imagine arriving at a hospital, expecting the swift, high-tech care we often take for granted. Now, imagine every digital tool, every automated system that assists in your diagnosis and treatment suddenly gone. This isn't a scene from a dystopian film. This is the harsh reality for many London hospitals today. Just over a week ago, on the 4th of June, a critical cyber attack targeted Synnovis, a major pathology firm servicing several key hospitals in London, including the renowned Guy's and St Thomas's Hospital and King's College Hospital. This wasn't just any disruption. This was a ransomware attack that has since thrown London's healthcare system into unprecedented chaos. As I speak, hospitals are struggling to cope. The automated bliss of digital healthcare systems has been replaced by the arduous task of manual entries. Blood samples, usually processed in minutes by machines, are now being tested manually by overworked staff, their hands guided by the urgency of medical needs versus the backdrop of technological paralysis. Dr. Annalisa Rigby from King's College Hospital shared the immense pressure her team is under. Imagine, for a second, being a doctor or a nurse in that environment. Your patient needs a blood transfusion, an operation, or just a simple blood test, but the tools you rely on are just gone. Every result now requires a double check, every sample a manual entry. It's slow, it's exhausting, and yes, it's prone to errors. Operations have been cancelled, urgent cases transferred, and the ripple effects of this cyber siege are palpable. The strain isn't just on the machines that are down, it's heavily on the shoulders of our healthcare workers. They are fighting a battle without their most trusted allies, their tools. An NHS spokesperson put it plainly, NHS staff are working around the clock to minimise the disruption to patient care. But the truth is, no amount of overtime can quickly fix what's broken. Pathology services, the backbone of diagnostics, are crippled, affecting a wide range of treatments. This isn't just a local news story about a cyber attack. It's a glaring beacon on the vulnerabilities of our increasingly interconnected and digital world. It's a wake-up call, a painful reminder of the dangers lurking in the shadows of our taken-for-granted digital conveniences. As this situation unfolds, one thing becomes increasingly clear. The resilience of our healthcare professionals is nothing short of heroic. But even heroes have their limits. As we navigate through this digital disruption, let's not only think about how to protect our systems better, but also about how to support the people at the heart of these systems, our doctors, nurses, and healthcare staff. Stay tuned as this story develops, and remember, in a world wired for connectivity, sometimes the most significant connections are the human ones we rely on in times of crisis.